Hello everyone. In this video we will discuss some important questions from ESR, that is erythrocyte sedimentation rate. What is ESR and what is the principle of ESR? When anticoagulated blood is allowed to stand in a tube, the rate at which the erythrocytes settle in a given length of time is known as erythrocyte sedimentation rate. Which factors affect ESR? There are three factors: plasma factors, red cell factors, environmental factors. Plasma factors include fibrinogen, alpha-2, beta and gamma globulins, albumin, lecithin, and cholesterol. Red cell factors include anemia, rouleau formation, microcytes, macrocytes, red cells with abnormal shape such as sickle cells or spherocytes. Environmental factors that include room temperature. Ideally, room temperature 18 to 25 degrees centigrade should be maintained, as increase in temperature increases the ESR values. Factors that cause decrease in ESR includes polycythemia, macrocytosis, hypofibrinogenemia, spherocytosis, sickle cells, steroids, and NSAIDs. Factors that increase the ESR includes anemia, microcytosis, chronic renal failure, increased plasma viscosity like fibrinogen. At what temperature ESR should be maintained and why? Room temperature should be maintained as increase in temperature increases the ESR values. Enumerate different methods of ESR estimation. There are three methods: Westergreen method, Winthrop method, which not routinely used, automated analyzer. What are the sources of error in ESR estimation? Tilting the tube accelerates ESR. An angle of even 3 degrees from vertical may increase ESR by about 30%. Lower or higher atmospheric temperature will affect ESR. Refrigerated blood sample must be permitted to reach room temperature before test is performed. If concentration of anticoagulant blood is more, ESR may be slowed down. Hemolysis will modify ESR. The test should be set up within 4 hours after blood collection, or maximum up to 6 hours provided the blood is kept at 4 degrees centigrade. On standing, the RBCs tend to become spherical and less inclined to form rouleau. Dirty tubes will alter ESR. Bubbles in tube will affect ESR. What is zeta sedimentation rate and what is its significance? A capillary tube filled with EDTA blood is spun in centrifuge, that is a special type of centrifuge, in vertical position 4 times each for 45 seconds. This results in controlled compaction and dispersion of RBC, allowing rouleau formation and sedimentation in 3 minutes. The capillary tube is then read like a microhematocrit. This value is known as zeta crit, that is value of percent of RBC to that of the total column. Zeta sedimentation ratio. The true zeta hematocrit is divided by zeta crit and the resultant expressed as a percentage is the ZSR, that is zeta sedimentation ratio. It is not affected by anemia, hence is easier to interpret. The method requires only 0.1 to 0.2 ml blood. The adult normal range is 41 to 54% for both sexes. In which condition there is prognostic importance of ESR? ESR is useful in decreasing because more specific tests such as CRP are available for evaluating disease. ESR is moderately raised in inflammatory conditions, for example, TB, rheumatoid arthritis, chronic infections, collagen diseases, and neoplastic diseases. ESR rises markedly in monoclonal blood protein disorders like multiple myeloma, macroglobinemia, severe polyclonal hyperglobinemia, and hyperfibrinogenemia. Useful in diagnosing and monitoring treatment of temporal arteritis and polymyalgia rheumatica. In Hodgkin's disease, ESR is useful prognostic test in absence of symptoms like fever, weight loss, night sweats, etc. The ESR is decreased in polycythemia vera, hypofibrinogenemia, congestive cardiac failure, red cell disorders like sickle cell anemia, and spherocytosis.